Well, hello, and first let me tell you that 95% of all diabetes is type 2, and a little less than 5% is type 1. Now, type 2 diabetes is basically an onset of insulin resistivity and a problem with glucose that results in high levels of sticky, thick blood, oxygen deprivation, weight gain, fatigue, bloating, distension, all kinds of energy deficiencies. Now, what diabetes really is when a person eats food and they eat the wrong food, that food suffocates them and that makes them tired. They eat the wrong food again and again, and it causes this auto-intoxication, resulting in a problem, and that problem is high glucose. So, how do we first take care of it? We first identify what the person is doing, and 9 times out of 10, their stomach is not emptying the proteins. And the other big problem that we found is that people don't eat enough vegetables. You need lots and lots of green, red, and purple leafy vegetables. That helps a great deal. So, what are the problems with diabetes and how is diabetes caused? Well, it's caused by you eating the wrong foods at the wrong time, maybe chewing too fast, maybe eating too late. Maybe you're under stress and under pressure and you're not sleeping well. All of those things are factors. The biggest factor that comes into play first is that we have to have the proper digestion. When we have the proper digestion, the first part of the stomach has to be relieved and emptied so that the signal for satiation goes to the brain and the person is able to say, gee, I feel good now. I don't eat that much. Well, doc, you're giving me this enzyme and I don't seem to be eating that much. That's because you're breaking down your proteins, your fats, and your carbohydrates. And by doing that, you're doing so much better. And at the same time, you're lowering cholesterol, you're lowering all the things that are caused the blood to become sticky and thick. So then what we do is we look at deficiencies. All diabetics have alpha lipoic acid deficiencies, they have magnesium deficiencies, they have a number of things that go on, and so we have to correct that. So there's a food, it's a green food, and this green food is called arugula supercardiogreens. And what this food is it's full of enzymes. It's got amylase, protease, lipase, cellulase, hemicellulase. It's got probiotics in it. It's got everything in it. It's got the magnesium. It's got the alpha lipoic acid. It's got lots of great things in it. You just take a scoop of it, put it in water, you drink it. It helps you to digest and break down. You feel better. Even the magnesium is in it. Then what I say to people, if they're having trouble sleeping, take a little magnesium before you go to bed and don't eat late at night. Eat for 12 hours, fast for 12 hours. That helps your diabetes go low. Helps your glucose go low. Helps your system to feel better so that when you wake up, you feel better and you have energy. And remember, food is energy. The final thing I'm going to talk about is berberine. And berberine is also a very, very important part of helping to lower glucose. And berberine can help lower cholesterol, and berberine can do a great deal of balancing glucose. And so these are things that are natural, and they're all natural. And the one thing I have to say in ending, chew your food. Don't bite and swallow like a boa constrictor.
Very good. Thank you so